Knowledge gaps around therapeutic ultrasound in companion animals review. Significant gaps in scientific knowledge remain around the clinical effects of therapeutic ultrasound in dogs, horses, and donkeys, according to the authors of a just-published review. Therapeutic ultrasound is used in sport and companion animals to treat diseases and injuries affecting tendons, ligaments, muscles, joints, and bones. Usually, there are 2 to 6 treatment sessions weekly for up to 4 weeks. The scientific evidence for the treatment has been questioned, sparking the review by Anna Boström and her fellow researchers. In 3 major databases, relevant articles published between 1980 and 2020 were identified. The risk of bias in each article was evaluated. To stay up to date with latest top stories, make sure to subscribe to this YouTube channel by clicking the button above this video. The review team, reporting in the journal Animals, found 24 relevant articles on the effects of therapeutic ultrasound in dogs, 9 in horses, 2 in donkeys, and 1 in cats. The treatment was employed on tendons and ligaments, as well as for bone healing, acute aseptic arthritis, osteoarthritis, paraparesis, hindquarter weakness, and back muscle pain. Most published articles concern musculoskeletal conditions. From several experimental articles with a low risk of bias, there is moderate scientific evidence that therapeutic ultrasound promotes bone healing, at least in dogs, the review team reported. These findings require confirmation in high-quality clinical trials. However, for the treatment of other musculoskeletal conditions, the scientific evidence is insufficient because of the high risk of bias. The studies have been few, and most of them involve only a small number of animals. Many studies also have methodological problems with compromised study quality. When beneficial results are reported, they have not been repeated in independent studies. They noted that favorable effects on bone healing have been reported in experiments where bone fractures have been created surgically in dogs. There is also scientific evidence that therapeutic ultrasound treatment of testicles in dogs and cats arrests the production of sperm, indicating that it may be used for contraception. The favorable effects again need to be confirmed in high-quality clinical trials. The authors said there is moderate scientific evidence that ultrasound administered with certain dosing can cause a heat increase in muscles and tendons in healthy animals. These heat increases and possible non-thermal effects of ultrasound could tentatively be of benefit in the treatment of clinical pain conditions or injuries. 2 experimental studies in sound horses showed temperature rises in muscles during treatment. At the same ultrasound frequency and intensity, the temperature rise seems to be considerably higher in tendons. The certainty of this evidence is assessed as moderate to high, they said. The studies did not evaluate which temperature rise, if any, would be therapeutically optimal. The large proportion of studies with a high risk of bias emphasizes the need for more high-quality research, using well-established research methodologies to evaluate the potential therapeutic effects of therapeutic ultrasound in sport and companion animals, they said. The authors noted that with the exception of intended testicular tissue degeneration, when therapeutic ultrasound is used for contraceptive purposes, no major long-term adverse effects of the therapy were reported in the articles included in the review. The review team comprised Boström and Hella Hietainen, with the University of Helsinki in Finland, Kjell Asplund, with Umeå University in Sweden, and Anna Berg, with the Swedish University of Agricultural Sciences in Uppsala.